Welcome to Maddie's Monthly Foster Connection, a monthly webcast where we learn about topics of interest to those of us who are interested in starting or expanding foster programs. Our guest today is Dr. Rachael Wooten. Dr. Rachael Wooten, a passionate shelter medicine veterinarian with 7 years of experience, proudly represents her Black and Puerto Rican heritage. She earned her DVM from Tuskegee University in 2017, and after graduation, she completed a shelter medicine specialty internship at the University of Illinois CVM. Currently serves as the medical director at One Tail at a Time Animal Rescue in Chicago, and has recently completed a shelter medicine fellowship through UW-Madison and UC Davis. Dr. Wooten actively advocates for diversity, equity, and inclusion within the veterinary community. Her commitment to fostering an inclusive environment is underscored by her completion of the Care Ready certificate and serving on multiple DEI boards, further enriching her ability to make a meaningful impact in the field of animal welfare. Welcome, Dr. Wooten.
Hi, Kelly. Thank you so much for having me. I'm really excited to be here. If you joined last month, we went over dogs, and this time we're going to do cat-specific infectious diseases, just from my shelter med point of view. So just a little bit quickly about me is just as Kelly said, I'm the medical director at One Tail at a Time, which is a foster-based rescue located in Chicago, Illinois. We generally, our intake is about 1,800 animals annually, and that usually includes dogs, cats, rabbits, and some other small critters like guinea pigs. I went to school at Tuskegee University and graduated in 2017, and then completed the specialty internship in shelter med and then the fellowship from UW-Madison UC Davis a couple years ago. So hopefully for this presentation, why does it really matter and why are we giving it? It's because foster caregivers really do play a pivotal role in identifying, managing, and preventing the spread of infectious diseases in the animals we care for, and in our cats especially. And so hopefully early detection and proper care significantly improves outcomes and prevents zoonotic risk. So hopefully in this presentation, you'll learn how to recognize those common infectious diseases in cats, how these diseases spread, including their risk to you as a caregiver, and then how to care for infected cats and protect yourself as well as other preventative strategies and resources that I can provide. So I'm going to start off with one of our favorites. I'm sure everyone has seen it if you're in the animal welfare field, especially in our cats, is ringworm, so dermatophytosis. So ringworm, although it has the name ringworm, it is not actually a parasite. It is not a worm at all. It's a fungal skin infection that usually causes these circular skin lesions that we see. And so what is the main thing about this is how it's spread is that I want everyone to know is that it is in the environment already. So it lives in the, those dirt, moist environments just around everywhere. So usually what you have to do is have direct contact with infected cats, or cats come in direct contact with contaminated bedding, brushes, or the environment. It is zoonotic to humans. However, it is a pretty low risk to humans. But if you are immunocompromised or have weakened immune systems, then you are at a higher risk. But with proper prevention and care, then you're able to, reduce that risk pretty significantly. I think one thing to note is like you might see this a lot in humans in toddlers who, frequent daycares and things like that, because they are a weakened immune system being a toddler, or then also like in elderly patients or anyone who is immunocompromised. The signs that we typically see in our cats are going to be the circular hair loss. Sometimes that is a little bit brittle or dry looking, scaly skin. The fur themselves can kind of look a little bit brittle in case you don't see these like definite lesions of hair loss. And most of the time it isn't too itchy, but in severe infections, it can be itchy as well. The good thing about ringworm, and something that I really want to, hype on, is that it is not life-threatening. And although it is highly contagious, and cats are kind of the best, I feel like they just love cats so much, and that it's really highly contagious in them, is that it's usually self-limiting. So even without treatment, they will typically get better on their own with their own immune system. But also that because the risk is low, And although we are able to get it, it is super important that we get these cats out of the shelter so that we can reduce the risk to the rest of the general population. And so having our fosters who are like our ringworm gurus, or however they like to call themselves, ringworm fighters, I think I've heard before. It's just super important because it helps the cats so much in fighting the infection as well, because the immune system in the shelter is already decreased because they are in a highly stressed environment. So their immune system is a little bit lower. So as soon as they get into foster homes, we're seeing the infection clear a lot quicker. Following the treatment protocols and things it's a lot easier for our staff if you're doing it at home, and then it's less of a risk that we act as fomites, or meaning that we're carrying the fungus on our clothes or just on our hands and not realizing it and then touching something else. And that's how other animals are able to get it as well. So like with fosters, it's really important that we're wearing gloves, we're washing hands when handling infected cats, isolating the cat to an easy to clean area. So like your bathroom is like incredible for this. And cats don't need like a huge amount of space. And like, so it's really nice that if you can host them somewhere, even if it is just for the weekend or something like that, we always encourage it. We limit contact with children or immunocompromised individuals just because they are at a higher risk of contracting ringworm. And then just following the antifungal treatment protocols that your medical team is prescribing. Those can include oral medications, but most likely they're definitely going to include like topical treatments, and that can be creams and or baths or mousses, things like that. Topical treatments are really great for skin infections and things because you're hitting it right at the source. And then afterwards, always disinfecting surfaces, washing bedding regularly, and just making sure you're keeping everything as clean as possible and easy to clean as possible. So you don't want furniture and things that are hard to clean. That's not where you would want to put a ringworm cat, but somewhere that's easy to wipe down, easy to clean surfaces. Those are always really great. Then prevention. So there's not too much you can do to completely prevent it in the fact that it's probably everywhere and it's hard to, see with your regular eyes. But at shelters, what you can assume that we're doing is that most shelters on intake are screening cats in the shelter for ringworm, and then promptly isolating the cat if you do find out they're positive, or if they start showing symptoms. So if you start seeing a little bit of hair loss or something like that, you're isolating them from any healthy animals, and then getting treatment recommendations and things like that. For humans, just washing your hands thoroughly. I recommend changing clothes if you go in there and interact with them, just so you're not bringing it into the rest of your house and things like that can possibly infect other areas. So the next one is just feline panleukopenia virus, which is also known as feline parvovirus or feline distemper. So it's a highly contagious viral disease causing severe gastrointestinal and immune system damage. So feline panleukopenia is typically spread through the feces or bodily fluids, and it's a very good virus that is really hard to kill in the environment. So contaminated surfaces and in the environment, it's hard to kill, but there are good disinfectants that you can use, such as rescue or diluted bleach. Those are able to actually kill panleukopenia, but it is still a hardy virus that can live in the environment for a long time. So that's something to keep in mind, especially if you ever have a kitten who possibly has it in your home at one point. You want to make sure that if you volunteer or rescue somewhere else, you let their shelter know too, so that they can provide you with animals who are hopefully already vaccinated for it, since it can still be in your environment, even if you are cleaning very well. The positive thing is that it has no zoonotic risk, so there's no risk to humans and help in taking in these animals. The symptoms that you're going to see are vomiting, diarrhea, lethargy, fever, reduced appetite, and dehydration. And so I think the big things for this is that catching this virus early is the best thing we can do for these kittens. And because it does have a very high mortality rate, because it is hard to treat and the virus has to make its course. And with that is the virus is actually attacking the animal's immune system, their white blood cells. So that's why it's called panleukopenia. So it's all the white blood cells are very decreased. So they actually have no immune system to fight this off. So what we have to do is help make sure that we're treating all their symptoms. And so most likely you'll see first is like a lack of appetite or a decreased appetite. And then that's usually followed by either diarrhea or the vomiting. I feel like if you start to notice some of that before the reduced appetite, then we have a better chance, or as soon as you see the diarrhea too, reporting all of those symptoms is really important. That's how the medical team can kind of decide like, okay, wait, we might be dealing with something more than just regular kitten diarrhea and making decisions off of that. So for fosters, it really does help. So as soon as we're able to isolate infected cats from especially a general population, such as in shelters, because it's a high risk and high stressful environment. Their immune system's already going to be low, and we want to help kind of boost their immune system as much as possible. But also because this is a highly contagious virus, as soon as we're able to isolate them and especially bringing them out of the environment completely, we're preventing other kittens and other cats from getting this virus as well. So wearing gloves and using foot baths when entering the cat space, just to make sure you're not being a fomite like before and bringing it into other areas in your home. But really ensuring the hydration and supportive care is the best thing to do for them. So that might include like syringe feeding, or adding additional wet food just to make sure like we're keeping as much moisture in them as possible. Staying in close contact with your coordinator or your medical team to let them know this isn't enough. They're still having this issue, keeping up with their weights and things like that, so that we can add additional treatments at any point. And so that's really following the veterinary instructions are really important, especially if we're going to try to treat it as outpatient. Because if you do catch it early enough, you sometimes are able to bypass hospitalization, which is great for them, and being able to treat the symptoms that are popping up where they don't ever actually plummet completely. And we keep them eating with anti-nausea medications and things like that. It really, really helps their chance of survival, and then also just reducing, again, the risk of infecting others. And then afterwards, maintaining a clean environment and with proper disinfectants. So bleach, again, is something I would use, or rescue is like my favorite disinfectant right now. So that's something that you could talk with your shelter team about and possibly purchase too if you are having a lot of them in your home. Prevention, so vaccination, luckily we are able to vaccinate for this. And so that's why it's usually affecting kittens and immunocompromised adults or those who are not vaccinated. But so vaccination is essential. Most of our vaccines are modified live vaccines. So we are getting some type of immune support within the first 3 to 5 hours, and definitely by some within the first 3 days. So it's really nice to have those so that we're able to kind of give them something and boost up in case they do come in contact with it. And then for humans, you're just practicing strict hygiene to avoid carrying the virus on your clothes and things like that and spreading it. Next, one of the most common things is definitely going to be feline upper respiratory infection. So with feline upper respiratory infections, it's usually a disease complex. So we just kind of group them all together. It's a group of contagious respiratory illnesses that are caused by either viruses or bacteria. The top viruses are going to be herpes virus, calicivirus, and then bacteria is usually mycoplasma and chlamydia. And so because of animal rescue or animal shelter, we don't usually have all the resources to culture every single infected cat and then find out exactly what we're treating and go from there. So that is why it's usually grouped in this, and how we'll make decisions based off of what we're seeing. And that's where it's really important for fosters to be communicating too, so that we understand what we're seeing and we can kind of decide, does it need an antibiotic or does it need really supportive care? Because viruses, as we know, can't be treated with antibiotics, but bacteria can. So it's kind of a little game like that we can play based off of their symptoms and how severe they are. So how is it spread? So it's usually spread by airborne droplets, direct cat-to-cat contact, or contaminated surfaces. Now, with the airborne droplets, it is pretty contagious, and I definitely will say a majority of us veterinarians believe every cat has most likely, in some point in their life, interacted with something and has contracted either herpes virus, which is the most common. And so, with that being said, it's just like with humans, where once you get it, it is with you for life, but usually you're just an asymptomatic carrier. And as your immune system drops, then you might have a flare up. So that's why some cats, or especially cats in high stress environments, end up having a lot of flare ups or chronic URIs, because they are stressed that their immune system just stays depleted enough where the herpes is able to kind of proliferate. There is a very mild risk to humans. I was actually, when I was doing the research, was kind of surprised about it, but because I was like, there's no risk at all. But there is a very, very small risk for bacterial infections, but it is super minimal. And just as long as you're taking care of yourself, it's pretty rare. In cats, what we're typically seeing is sneezing, nasal or ocular or eye discharge, and that can be either clear discharge, which usually indicates a viral infection, or sometimes if it's a colored discharge, then I would assume it's probably more of a bacterial infection that's happening, or it could be both at the same time. Coughing, loss of appetite, and fever. And those are some of the more severe infections you would get, but that would be kind of thinking of pneumonia and things like that. Usually the upper respiratory infections are usually pretty mild, but in immunocompromised animals or kittens, especially left untreated or just dependent on how they are, because they already have a lower immune system, it can become more severe. So what are we doing as fosters, and what are you doing to help? So again, isolating the affected cats. There's a theme here. It's always isolation, right? Isolating them right away. So what we want to do definitely is kind of clear up that congestion. So keeping their eyes and nose clean. Using a humidifier can help kind of break up some of that congestion. And if you don't have a humidifier, running your steamy shower is something we always do with our fosters, steam nebulizations. And so you could just have them in there while you shower. It just helps break up. They'll get the humidity, and it helps kind of help them get rid of that congestion. And then you just want to make sure they're eating and drinking. And the reason why we focus on the congestion so much is because cats and animals typically are olfactory animals who need to, they want their appetite and everything comes from their smell. And so when they can't smell, that's when they usually are like, oh, I'm not hungry, or I can't eat, or something like that. So worrying about that, looking for that, and trying to clear that up is why it's a big priority to us as well. And then if you are given antibiotics or any other immunosupport medications, just administering them as prescribed. And then if you're unable to, because we all know sometimes cats don't like oral medications or things like that, talking and staying in touch with your team so that we can find other solutions and other ways to help them. The good news is that most of these viruses are in the vaccine FBRCP. And then, so vaccinating our animals is really important, and then reducing overcrowding. And that's just to help decrease their stressful environment they are in, because cats, although they do like to have companions, they don't like being in a high stress environment with overcrowding. That's very stressful to them. So it will lower their immune system. And then for us, it's just practicing good hygiene and keeping our clothes and things out of touch from other animals. I wanted to specifically talk about feline calicivirus as well. This is a part of the upper respiratory infections that we do group, but I wanted to talk about it because sometimes you do see some other specific symptoms that calici is kind of telltale of calici versus some of those other infections in the upper respiratory complex. So it does primarily affect the respiratory system, mouth, and then sometimes the joint. Again, it's going to be spread by the air droplets or direct contact with infected saliva, nasal discharge, or then if it's in the environment, so a cat sneezed and then it's laying there, someone else rubs against it, contaminated objects. Again, there's no zoonotic risk, so you can't catch it, which is great. Signs in cats, so sneezing, nasal discharge, that's why it is grouped in with the upper respiratory infection. But here's the difference is a lot of the times cats will get mouth ulcers, so usually on their tongue, or it could be sometimes on their nose as well. And because of those ulcers, that they're very painful and can cause drooling. Then you might also get a very high fever with calicivirus, and then occasionally cats can be limping. And so you might notice they're limping on one limb the first day and then a different one the next day. That can kind of be an indication that they might have calicivirus as well. Usually it's pretty mild, but severe strains can cause life-threatening pneumonia or systemic disease. Or if the lingual, like those ulcers that we're talking about, they're very painful, it can cause pretty severe disease that's causing them not to eat and things like that, which leads to other issues. So for fosters, again, we're providing that stress-free environment. We're isolating infected cats from healthy ones and always monitoring for worsening symptoms, and then kind of talking with your team again, because it might start as a mild, just, ocular nasal discharge, and we're doing what we have to do. But then if you start noticing that they're drooling, or you start noticing that they have like a red spot on their tongue, those are those indications where you need to say something else so that we can provide other support before it's too late. So when we think of pain in people or in animals, the pain threshold is always better if you can stop the pain before it happens. So it's a lot harder to play catch up and try to treat the pain afterwards. But if we could get it before it happens, then that really helps. So then just being able to administer the medication, so antibiotics for secondary infections that can occur, or then pain relief, like I was saying. And of course, vaccination is like the number one biggest thing we can do for prevention. And then again, minimizing the overcrowding and those stressful environments. And for us, just keeping clean surfaces and maintaining washing our hands, all of those things are going to help. The next common disease is toxoplasmosis. It is an infectious parasite that affects multiple organs in cats and people. So this is something that is zoonotic to people, and it's more, again, in immunocompromised people or in pregnant people, and so with that, it's mostly because it can cause spontaneous miscarriages or abortions, things like that. And so that's why when we think of toxoplasmosis, and why I wanted to mention it, because it can affect us as people. So if we do suspect any of these symptoms or any of these signs, or we confirm toxo in a cat, you want to just be communicating with your team so that you're keeping yourself safe along with keeping the cat safe as well. It's very hard to it's harder for us to get it from the cat because it's spread through infected feces and then eating raw meat, which typically we do not do. But because cats can shed it in their feces, that's what we want to be watching out for and remembering. And that's why I wanted to include it today. Cats are usually asymptomatic, and rarely do we actually see an active form and infection of it, but they can be carriers. And so if they are, usually it's fever, lethargy, and then telltale signs are usually neurologic signs. So that could be like spinning or ataxia, like where they're kind of clumsy, or different like neural issues like that. Most cats recover with treatment, so we are able to treat this, which is great. But in some serious, rare cases, they can become more serious and fatal. And that's usually if it's caught later on, and just how far it's progressed, typically with how far the neurologic issues have progressed. And so why I mentioned this is for foster parents. So the general recommendation is that pregnant fosters avoid cleaning litter boxes. And if you do clean a litter box, it should definitely be within the first 24 hours. So daily litter box cleaning is recommended, but we say that especially because we know that basically the cysts that are shed in the feces, they release the spores within 24 hours. So because we don't know if a cat has it or is a carrier of it, that is why it's always recommended if you have a cat that you no longer clean litter boxes when you become pregnant. But it's just important that it's because cats, if they are going to shed it, they're going to shed it for a couple weeks within the year, but we just don't know. And it's not routine to test because it's not like it's just something you could test in their feces or something like that. It's usually a blood test, and it's not always accurate if they don't have an active infection and things like that. So those are why it's always recommended, regardless if you have your cat for even 10 years of your life, to still not be cleaning their litter box. And then you should always be reporting any neurologic signs in your cats to your medical team, just so that they can take the necessary next steps to protect you and start treating the cat. So then the prevention is going to be the litter box hygiene, and then no raw meat feedings. Our next one is going to be intestinal parasites. So just like dogs, our cats are susceptible to roundworms, hookworms, whipworms, tapeworms. So all of those fun worms that love to live in the ground. So they're usually ingested from eggs from contaminated environments, but some of these are also able to be passed through the mother's milk or through her placenta. So sometimes the kittens are even born before they even see, like as soon as they're born, they already have some worms. So that is why it's super important to stick with a good deworming protocol, and recommending deworming is, I'm sure every shelter and rescue has probably a dewormer that protocol that they follow. And so typically it's not a huge risk, but it is something just to be mindful of. With a zoonotic risk, there is a risk to humans. And it's not usually the same as with animals where you're seeing the diarrhea, but some can cause skin and organ issues. So they can migrate through and they like go through your skin, or they end up in different organs like your eyes. It is super, super rare. So you don't want to scare you with that. And as long as you're practicing good hygiene, it is super rare that this would happen, because again, you have to ingest these eggs. So you would have to be kind of eating their poop or doing something in that sense where you're not cleaning or washing your hands frequently afterwards. If you do come into contact with feces, especially while cleaning, because kittens can be dirty, then that's how you might come in contact with that if you end up eating it. Signs in cats is typically diarrhea, bloated belly, weight loss, and a dull coat. So those, usually you see them in kittens too, especially like their little round bellies. We usually kind of assume like, oh, they probably have some intestinal parasites. That's why they get deworming at usually all of their vaccine appointments. It's very treatable, but it can become serious if there is a very large burden of worms, which they can cause impactions of their intestines. So it kind of like it gets stuck and they can't pass any feces or anything. They might need surgery for that, or some of these parasites do like affect by like they basically suck blood to live, and so they can cause severe anemias and things like that. That can be detrimental to kittens. So prevention is then deworming and then cleaning litter boxes frequently and practicing good hand hygiene. The next one is coccidia. Coccidia is also a protozoan parasite that kittens and cats usually get, that causes diarrhea. I just wanted to include it because sometimes it's not a worm, it is a protozoan parasite. But again, it is contaminated feces or the environment. There's not a risk to humans. We have our own version of it. Signs in cats is diarrhea, weight loss, and dehydration. It is treatable, but it is not one that is in the normal deworming protocols unless your shelter or your rescue has a known burden, like if they know they have a high population with this, then they might add it to their deworming protocols. That might be routine. But if not, then they usually add it into if like the kittens are still having diarrhea and the normal treatments aren't working or things like that. The big thing is that reinfection is really common because this does make kind of like a pastier, like a pale brown diarrhea typically, that it's a little bit harder to clean. You just want to be making sure that you're cleaning it and cleaning the litter box frequently, because cats are so clean that they're so good at reinfecting themselves, because if they get something on their paws, that what do? Immediately they start cleaning themselves, or if it's on their fur. And so if you have kittens, a litter of kittens, or they might be like even just kind of dirty and like stepping on it and then playing with each other. It might be on their fur and then they clean each other. So those are the types of things that as foster parents, you want to be looking out for and cleaning them off, cleaning their environment, and you're just monitoring them and trying to isolate if you can, so that would mostly be like isolating litter boxes, having separate ones for those who are healthy and those who aren't, and just making sure they're staying hydrated and eating, because diarrhea leads to dehydration, which is when things become more serious. Usually when these things happen, like always including wet food in their diet is very helpful, because that helps add extra moisture to their body as well. So that helps them stay hydrated better, access to clean water, and then cleaning the litter box frequently. And as I said, rescue is a great disinfectant. So that's usually, it also helps take care of coccidia as well. The next we're going to talk about is feline leukemia virus, or so FeLV. So it's a viral infection that suppresses the immune system. I love to call FeLV the nice cat disease, because it is spread through just being a very sweet cat, or just without being any like kind of mean contact. Like, so it's just bread and saliva. So if they're licking and cleaning each other, they can get it. Nasal secretions, urine, feces, and then milk from infected cats, so through the mother. And so it's not anything that the cats are really doing any wrong, but if they cohabitate and live together, they most likely are spreading it between each other. The good news is that you cannot contract this. In cats, it is a progressive disease over time. So once they get it, they can remain dormant, and it can just continue to spread it. And usually they can live very happy, healthy lives with it. But it is affecting the immune system and does suppress it. So it is progressive over time, and usually does amount to a slightly like a shortened lifespan. So with that, you most likely are seeing like weight loss or a poor coat condition. Usually we catch it when there's an animal who's having recurring infections. So if like we get a cat who's living in a foster home and they're doing very well, but they keep getting upper respiratory infections. So like, we're like, why is your immune system keep getting suppressed? What's happening? That's usually when sometimes we'll, start testing for FeLV, as we don't routinely test at our rescue. And so it's something like that we would think about. Maybe we should start testing and seeing, are you a carrier potentially? And then going from there. Because if you have a lower immune system because of FeLV, that's why you would continue to get recurring infections. It causes an anemia later on, and like weakness and things like that. So basically kind of chronic infections, chronic diseases, what you would kind of see in those animals. With foster parents, so we typically recommend keeping FeLV positive cats isolated from non-FeLV positive cats. And then you just want to, when you do have a known positive cat, you want to monitor closely for infections, and just make sure that you're staying on top of them, because they're going to need just that little extra support. Their immune system's going to need some extra support and from us, so that we can keep them healthy, get rid of it as fast as we can, so that they don't have to fight an infection long, especially if their immune system can't handle it. Care tips are really just providing a low stress environment, and then just sticking with regular vet checkups and all of that, because they can get dental disease. It's just a lot harder for them to fight off illnesses and things. So we want to make sure we're checking for that. I'm going to talk a little bit more later about vaccinations, but there is a vaccine for FeLV cats, and then there is a test that you can do for it. The testing, the reason why some shelters and rescues are moving away from testing it frequently is mostly because they can be kind of unreliable. They're very good for like in the moment tests, but they're not super great to confirm that this animal does actually have an active infection of FeLV. And so then you have to do a lot of other tests to confirm over a long span of time. And there actually is a pretty low risk of transferring it from cat to cat within shelters, unless they are living in these multi-housing environments. And that's when sometimes they might choose to test them more frequently. The next disease is feline immunodeficiency virus, so FIV. And this is why I was taught the nice cat disease versus the mean cat disease, because this is a viral infection that also weakens the immune system. But this one is what we would say the mean cat disease. So it's really bite wounds from infected cats. So it's really like that deep-seated wound to get the saliva in. That's typically how FIV is actually transmitted, and through other bodily fluids as well. The zoonotic risk, there is no zoonotic risk, so you cannot contract it from your cat. It's different than FIV is obviously feline specific, HIV is human specific. Signs in cats, so it's going to be a progressive disease like FeLV, but it can lead to fatal infections because of the weakened immune system. And so typically what we would see is going to be weight loss, recurring infections again, a poor coat quality, and then with these guys, you can see inflammation. So you can either get bad gingivitis, so bad dental disease, or you can even get sometimes swollen paw pads and things like that. So the good news, because we've done so much more research and have found out so much more about these diseases, is that FIV cats can actually live with other cats who are not FIV positive as long as they are nice. So because it's how it's spread. Like as foster homes, you're just monitoring their behavior very closely and seeing like, can they live with another cat? Is that okay? Like we prevent fighting with any other cats and things like that. Because then they can potentially go to another home with a cat. Or if they are more prone to fighting or something like that, then we would recommend they be adopted out as a single cat household. And then it's just monitoring their health closely. So if they get a wound or if they get upper respiratory, just speaking very closely and regularly with your veterinary care team, because then you would just want to make sure that we're helping provide the extra immuno support that they need. Prevention is with testing, and then keeping FIV positive cats indoors. So because of the potential that outdoor cats have a lot higher potential of getting into territorial fights or things like that, we want to keep any known positive cats indoors to make sure that doesn't happen, so we can stop the spread of this disease. And then our last thing that I'm going to talk about for our infectious diseases is feline infectious peritonitis, or FIP. FIP is actually a mutated form of feline coronavirus. So coronavirus is found and spread through feces, saliva, litter boxes because of the feces. And so what it is that the animal's immune system is actually mutating the normal coronavirus that they come in contact with in the environment, and they mutate it, and it turns into this, unfortunately, usually fatal form of the coronavirus. And there's two different types of this virus. So it's called wet FIP, which usually you'll see fluid in the belly. So that's like kind of the telltale sign of wet FIP, is like a distended abdomen that feels like squishy, and like when your vet feels it, they can tell there's fluid in the abdomen. And then there's dry FIP, and that could also go to the chest too, and cause like coughs and things like that. So fluid in the chest as well. Neurologic signs are considered in the dry FIP form. And that's typically, you're going to see like spinning or some head tilts. Sometimes you have ocular symptoms. It just kind of depends, but they can present in two different ways. But then there will always be like lethargy and weight loss because it's a progressive disease. So as I said, it usually is fatal without treatment. But the prognosis is getting a lot better with newer treatments that are available to us now, and some that recently have become available to us in the US, which is a great sign and a great thing for us to be able to do, and to be able to treat this. There is a higher risk for cats who live in shelters and who live in like communal housing. So they're just like have a higher chance of either coming in contact with it or coming in contact with a potentially mutated version of it. But you still need to, like the cat itself needs to actually mutate the virus. It doesn't just because you like, so I'm trying to explain because it's a little bit difficult. But it's not contagious directly, but if you have a litter mates and one did pass away from FIP, the litter mate does have a higher chance of getting FIP, but it is not like a guaranteed chance that they're going to get FIP, if that makes sense. But so what you're doing is just monitoring them for normal and reporting any illnesses. So monitoring for weight loss, fever, or distended abdomens, and then just making sure you're just communicating with the team care tips. So just so you know, because the new treatments are, becoming more available, which is exciting. It is a long treatment and it is very inexpensive treatment. So I'm almost positive that it's at least an 84-day treatment. So it is very long and the medication itself is not cheap. So just keeping that in mind when this is happening. And then if your rescue or shelter that you work with does decide to treat, that you'll be in it for the long haul to, kind of make sure that we're getting this cat back to its healthy state. It can become in remission and typically does not relapse if they do become recovered, which is great. And just minimizing stress and good hygiene is what is recommended to try to help prevent it, but there's no guarantees, unfortunately, on how to truly prevent FIP. So with all this being said, what is the best thing, prevention and best practices that we can do? And so number one is going to be vaccination protocols. So we always want to protect them before exposing them. So that's the best thing that we can do. So it's the best defense against many of the infectious diseases we talked about. And foster caregivers, you can ensure that all cats receive core vaccines and boosters on schedule. So that's following whatever the schedule that your veterinary team or medical team that your rescue works with, that you're following their recommendations because they know their population the best. So making sure you're attending the appointments and, getting those boosters on time is just super imperative to making sure that we keep them safe. So the core vaccines in cats are going to be FVRCP, which is feline viral rhinotracheitis, which is a fancy word for herpes, calicivirus, and panleukopenia, which is those three big ones that we talked about. This is typically given every 2 weeks for kittens until they are at least 20 weeks of age. And if they're over 5 months, then they typically get one vaccine and then one vaccine's 2 weeks later. Rabies, you're given at it's usually required by law in most areas, so most shelters require it. And that's typically given between 3 and 4 months. So a non-core vaccine is FeLV. So it kind of really depends on your rescue and the shelter that you're working with. It helps prevent FeLV, but it does not completely protect any animals at risk. So it's not 100% effective of preventing infection. So it's not like if we gave vaccines, we can then just house anyone with anyone. So it's an additional operational cost that might not be as effective because most cats in shelters are not going to be housed together unless they're going into communal housing, but a lot do not go into that. And then it does help reduce the spread of FeLV. And then there's also recommendations to specifically on like how old they should be if you're giving them and things like that. So it really just is dependent on your shelter's modeling and how they do, whether or not this is going to be a vaccine, but it is something that is available. Foster specific tips. So what I would always suggest is just confirming vaccination status with your shelter before fostering, because then that kind of gives you an idea of like, oh, can they interact with my cat or can they, it's just a little bit different. Like, oh, can I, like some people like to introduce cats to other cats and things like that. But if they're ever single vax or anything like that, you want to definitely wait until they have their boosters before doing something like that. Always make sure your resident pets are fully vaccinated against the common shelter diseases so that you're protecting them because you are bringing another animal who does have an unknown history into your home. You want to make sure you're protecting your cat. And then kittens, like I said, should receive it up until 5 months of age. And then just avoiding exposure to unvaccinated cats and areas that other unvaccinated cats may frequent. I know some people are adventurers and some cats love to be outdoors too. So those are things that you want to be thinking about. Prevention and best practice. So next is hygiene practices, minimizing disease spread. So good hygiene helps prevent the spread of both zoonotic and cat-to-cat diseases. And so when we're thinking about that, it's always our hands. Like we always are pretty good with our hands. So always washing hands before and after handling flats, cleaning bowls or administering medications. You always just want to be constantly doing that. And I think that's something that most of us are pretty good at. But then it's usually thinking the surfaces afterwards. So where were they? Disinfecting their litter boxes, the floors, and high touch surfaces. So things you might not be thinking about is like, oh, my cell phone. Oh, cats love to go on my keyboard. like different things that you're like, oh, I wouldn't have thought to wipe that off, but that cat loves to go around there. Those are the things you want to be using. And using rescue is really nice because it's safer on some of our products than bleach or something else like that is. Laundry and bedding, you want to be washing bedding, towels, soft toys regularly with hot water and detergent. Drying kills most of the pathogens if it's on high heat. And so that's good to know because then you're able to reuse a lot of your bedding and things as long as they're easily able to be dried. And that's why you're thinking about where you're keeping the animals so that you are able to clean them up or keep them isolated until they're over their illness. Then they can have access to your whole house. And then air quality is always nice. It's a nice to have, it's not a must have, but using air purifiers helps reduce airborne practices and ensures proper ventilation. And always ensuring proper ventilation, though, is important so that if you do have anything like that, you can open it up and get good ventilation to clear it out. Then regular vet visits. So communicating often and especially early with your medical team or your shelter team, because symptoms to catch reporting symptoms early helps catch diseases and have better outcomes. So I just put a little thing together that's kind of like, when should you call your vet immediately? What should we be doing? So respiratory, so if there's really severe congestion or difficulty breathing, that's always a call. Swollen, crusty, or cloudy eyes, we want to be looking at eyes. Eyes can go bad very quickly, especially in cats. They're known, a lot of their upper respiratory can cause like ulcers and things like that. So those are always good things to be reporting. And then excessive drooling or ulcers, those are things you want to be reporting to your team because you might need more support than the typical upper respiratory infection is causing. GI issues. Cats typically don't vomit that often. So especially if they're vomiting 2 to 3 times a day, or if their diarrhea is lasting more than 24 hours, those are things that we're going to want to know because it is different than a typical course that we might be treating since we do see vomiting, diarrhea, upper respiratory almost every single day. It's nice to know that when there is a little deviation because it might change how we're responding to things. And then any appetite decrease, especially in kittens or anything, if there's anything less than, greater than 24 hours, greater than a day, it's something to keep in mind and just to be communicating with so that we're able to address the needs of that individual before it's so severe where we're seeing a lot of the more chronic weight loss and it's harder to treat the nausea and things like that afterwards. Behavior changes, so they might start hiding, they might have difficulty walking, especially if they're unresponsive or very severely lethargic. And I wanted to mention hiding in there because if you have a very social cat that's now kind of being more detached or hiding, that can be a sign that they're in some type of pain or having some type of medical concern. And so it's something good to know. And just to know, even if it's like not the most friendly cat where they're coming in your lap every day, but cats are kind of actually pretty social. And so you might always notice like the cat might not be on me, but it's in the same room as me. And, if they kind of do follow us around a little bit more than we think, not as obvious as dogs presenting their symptoms, but they do show us subtle things. And so those are good things to be noting and just like keeping a log of. Skin and coat issues. So if there's any patchy hair loss or crusty skin, if they're over grooming or if they're not grooming at all, those are all things that can indicate there's something going on with the cat. So it's all things that you would want to be keeping in mind and then potentially calling your medical team about. Quarantine and isolation. So preventing disease transmission. So especially newly fostered cats, those coming from shelters or unknown histories, those are ones that you would probably want to isolate for at least 14 days before interacting with your resident pets. And so, like I said earlier, a spare bathroom is a great place to quarantine because it's so easy to clean. And so why do we want to isolate? So a lot of the diseases that we talked about have different incubation periods. So incubation periods is about how long from coming in contact with that disease, when am I going to either break with the disease or potentially continue to spread it? And so those are all kind of different. Most of them are around 14 days, but some can be a lot longer. And those are things that you can ask your team like, oh, if I have this, I was diagnosed with X, Y, and Z. how long do I have to quarantine, or what can I expect kind of this disease process to look at? And I'm sure they'd be happy to explain it to you. From there, it also prevents the spread of respiratory diseases and other infections because those are so highly contagious because it's just from air droplets. It's so easy to just talk and then you're spreading that, or even just nose to nose. That's how animals communicate a lot of the time. So then what does it mean to isolate? You're using a separate space with its own bedding, toys, and feeding area. And bonus points if it's an easy to clean space. I won't get turned blue saying that enough. But yes, the back room is an incredible place, a laundry room, anywhere that's like super easy to clean that doesn't have like a lot of furniture that's hard to clean and disinfect. Wash hands and change clothes after handling an isolated cat, and then monitoring for signs of illness before introducing to other animals. And then last but not least, communication and reporting illnesses. So partnering with your shelter. So you are such a huge part of the animal's health and their trajectory in your animal rescue or shelter. And you're basically a larger part of the veterinarian like animal care team. So you just have to communicate. And then of course, like I said, promptly, efficiently, and then early. So it's just as soon as you think it might be something, it's not bad to start keeping a log of these things and just start to, kind of put everything together. So reporting symptoms, we're going to keep detailed notes on symptoms, appetite, stool, quality, and behavior, because those are going to be the questions that we're going to ask, like how long has this been happening, when do you notice it, how much did they used to eat. So these are all things that you want to keep in your head beforehand. Then if they ask for it, definitely sending daily updates with photos and videos if a cat is very sick. And so you want to just keep those things in mind, because sometimes it's like, oh, I think he might be limping. Oh, can you send us a video so we can see what that looks like? Because that's going to help us determine what we do next. And always doing these things sooner the better. So like our rescue, we have an email communication with our fosters. And so like sending an email, we're never going to be like, oh my gosh, that's the worst thing in the world. Like more information is better than no information at all. Coordinating veterinary visits. You want to just make sure you're following your shelter's protocols for vet care and their medication administration. So what the vet prescribes, just try to stick to it as best as you can. It might be a little bit different than what your private veterinarian might prescribe. And that's just because veterinarians in shelter med are usually doing general population control and population medicine. And then we're also thinking about finances a lot more, because we have to make sure that we can continue to do and treat as many and save as many animals as possible. So we want to make sure that we're trying to do the protocols that we can do. And then if directed, you want to administer your oral medications, dewormers, fluids sometimes. It's just all the things. And if you can't do it or you're having trouble, if you speak up and help and ask for it, typically someone is there to help you. And so hopefully that's something that can happen, because it is hard. It can be hard, especially if you're at home alone. Like most of the time in our clinic, I'm not seeing these animals and treating them just alone by myself. I always usually have one of my veterinary techs with me as well. So like we understand that it can be difficult, and we'll try to work within your means as well. And then record keeping, just kind of keeping an eye on it, just making sure that you know what vaccines and medications, and you get their past history and things like that, just so that you kind of have a good idea. Most of the shelters and rescues that you'll work with will have their own medical record that you don't have to keep that kind of information, but it's good for you to know it just in case anything else is happening. And then just final thoughts, foster care is prevention. So already just opening up your home is helping so much and preventing so many disease outbreaks. So really kudos to all you guys who are doing the hard work every day, day in and day out, loving on these animals who just need a little extra, love and care. But so you do that by opening up your home and then following the vaccine and quarantine protocols, practicing good hygiene, recognizing early symptoms and seeking care quickly, and then providing any stress-free environment. So you're already doing the hard work, and so we really appreciate you. And that is all I have for you today. So if you have any questions, we have about 6 minutes to spare.
Thank you so much, Dr. Wooten. That was great. We have a ton of questions. I have two quick things that I wanted to say. I put a document in the chat that is rescue protocol for disinfection. I spoke with the rescue representative a couple of years ago, and she was talking about this document, and I realized that I have been using Rescue for years and never realized that you need to leave it on for 1 full minute wet before you
Yes.
wipe it up,
Oh yeah,
And I
I did
was,
not mention that, and I was like, yeah, there are specific times for a rescue too. Like some is
yeah,
1 minute, some is 10 minutes. Like it's really specific. It can
yeah.
be really specific. But yeah, that is a great point. Thank you for including that.
Oh yeah, happy to. The other thing is if you are doing fostering, one of the things that we that I think we should talk about more is that when cats get sick in the shelter and go into isolation, it's I mean you mentioned it in your presentation that it's stressful. And they just aren't able to socialize as much as they were, but you've got kittens who are in like the most important period of their lives for socialization. So this is why we need fosters. So just reminding, you know, people of this fact. But we
Yeah,
have
it is so
time for
needed.
like,
I mean, especially with cats too. It's so needed. They are the most stressed in the shelter environment for me.
yeah, absolutely. Okay, we have time for maybe like 2 or 3 questions. Um, the first one is quick. Can you tell me if the Fortiflora probiotics help with worms and kittens?
So it doesn't help with like actually treating the worms if they already have the worms, but it does help increase their immune system. So probiotics are great for immune systems, but it's not going to actually treat if they are infected with worms.
With ringworm, do you need to wear disposable booties too?
So it's like the correct answer would be absolutely yes. Cover yourself up from head to toe, right? Especially if you're working in the shelter. In your home, I know that is not as feasible. So what I typically do when I have anything like that is I just have a change of clothes in there that I just change out of before leaving that room, just so it isn't, or like you keep a little thing outside of it. But I don't put my shoes in there or anything like that because those can be fomites.
Um, Also with ringworm, currently our shelter requires a 1 year gap in between the return of a previously infected cat and taking on new fosters. Is there a recommended time span between having cats that were treated for ringworm and taking on new fosters?
So I think it definitely depends. I think it depends on your team. I definitely would follow what they do because if they have a very highly endemic area where they're seeing ringworm constantly, it might just be what they found has worked best for them. I, off the top of my head, I do not know for sure, but we do typically say like if you had ringworm in your house, we try not to put super healthy animals in there. Um, like we do try to stick to like you would have ringworm or something like that, and you kind of become like our ringworm foster. But I would have to check to see if there are specific guidelines, unless you know Kelly up with ringworm specifically. It's really the
Um,
environment that you have to clean. That's the hardest part.
yeah, I don't, unfortunately. I will say that based on experience, we've had probably like dozens of kittens with ringworm come through and uh I've been cleaning. We have an air purifier. I use tons of rescue. But the only time we ever had one of our cats get it was when we had a cat that we didn't know had ringworm and was out
Yeah,
in the general population.
exactly. And I
So
feel like if you are following the general cleaning protocols, it does reduce the risk significantly. So it's just kind of risk um, control is best for your shelter, whatever they think is best.
um question, FIV is more commonly caught by male cats.
I don't know if there's a specifics completely. I can't tell you if that is 100% true. I do typically see it in, more of our tomcats because of the territories, and if they're usually intact and outdoor cats, they usually do tend to get in more fights. But I have seen it in females as well, so I can't tell you if it is a statistic like that.
Makes sense. And then does calicivirus infection make a feline more susceptible to FIP later?
Calicivirus should not. like it shouldn't like specifically just calici, but because they have a lower immune system, that might make them mutate a coronavirus. But it's not. We don't know why they mutated, so it's really an unknown of what's really actually causing it and how to best prevent it from happening. But we do know that it is in higher stress environments and multi-cat housing that we're seeing a higher incidence of it. But I haven't seen anything with specifically calici and FIP.
Thank you so, so much, Dr. Wooten. This was wonderful. And thanks to everybody who's been watching this webcast. We have questions that we were not able to get to today, and we will post them in Maddie's Pet Forum shortly. We have links to the presentation. Thank you all so, so much, and we will see you next time. Thank you.
Thank you.